is Dr. Baird. I am a chiropractor at Superior Healthcare of Navarre, also known as Baird Chiropractic Center. I'm here today with a new patient. Her name is Emma, and her mom is here. Lisa is behind the camera. I'm here today because there's a lot of questions that people ask about auto insurance and how auto insurance covers patients that are injured in a motor vehicle collision here in the state of Florida. And of course, every state is different, but Florida is considered a no-fault state. So we explain that to every patient and their family when they come in for treatment. Emma is here as a result of a collision that occurred last week. The first step in any treatment protocol for someone is to see our medical provider first. That medical provider rules out any other medical conditions that would exist and not allow us to do what we need to do to help this patient get to their maximum improvement from the injuries that they get in the car accident. So she has already seen our medical provider, so the second visit then is to see the chiropractic provider, which is me. In this visit, we go over some of the things that were done in the first medical side, but we're primarily focusing here on her injuries. Is her neck hurt, her back hurt, shoulder, lower extremities, upper extremities, whatever. So we address those, go over, we do a range of motion, some examination, some orthopedic findings. Once we go through to the extent of what her injuries are, then we will take some x-rays. Many times patients will go to the emergency room, we'll have x-rays or CT scans of certain areas, and we want to make sure that we have all areas covered. So we do have digital x-ray here, and we make sure that we're fully covered, because pictures are worth 1,000 words, and it tells us a lot about that patient's injuries. Now, with Emma, and we talk about injuries, we can classify them into two groups. We can call them hard tissue injuries or soft tissue injuries. And so, of course, when we talk about hard tissue injuries, that means we're talking about broken bones. Most of the time, front end collisions, rear end collisions, even T-bone collisions, there's not a lot of fractures or broken bones that exist. So what we're really classifying here are soft tissue injuries. Now, it's important to understand this, that soft tissue injuries, we're talking about four basic tissues. We're talking about ligaments. Ligaments are the tissue that holds bones together. And we're talking especially in the spinal column, since that is the primary focal point for the whole body and the skeletal system. So we're talking about ligaments. Two, we're talking about tendons. Tendons are what anchor muscle to bone. Three, we're talking about discs. Discs are the single layer of tissue that's a shock absorber between all the vertebrae in the spine, and there are 24. 7 in the neck, 12 in the mid-back, 5 in the lower back. The last tissue, and we're picking on these four for a reason, is the nerve tissue. The spinal cord sits behind this layer of, or this column of bone, and is the protective mechanism for it. So ligaments, tendons, discs, and nerve tissue. Those are important because these four have one characteristic. They're avascular tissues. That means they don't have blood flow. And as we know, blood needs to go to all tissues and organs to allow or give them what they need for growth and repair. So if ligaments, tendons, discs, and I'm going to repeat that over and over again, ligaments, tendons, discs, and nerve tissue are avascular, they don't get blood flow. So how do they get what they need for growth and repair? Well, that's where we come in. We come in two reasons. One, we're going to help those tissues heal, because we're going to provide movement and motion into those tissues very gently and with a very specific protocol to make sure that we're getting the nutrients into those tissues to allow them for growth and repair. And second, as a chiropractor, so first we're allowing those tissues to heal to their maximum ability, and secondly, we want to make sure that that column of bone heals in the correct position, therefore not creating long-term problems, especially in a young lady like this. She's young. We don't want her having permanent injuries, and that's our goal. We want every patient to come in and get them back to pre-accident status, okay? So with this young lady, we'll talk about her injury. She was in the car accident. She was not the driver, of course. She was a rear passenger. I believe in this collision that someone had pulled out in front of them. So the force of the impact of them hitting that vehicle is therefore transferred into the bodies or the occupants in that vehicle. And that forward and backward motion that's very rapid is what causes damage to those soft tissues. So our job is to first assess how much damage is done. And a lot of it is dependent upon how bad are the symptoms. With Miss Emma here, she complains or describes her pain on a numerical scale of 1 to 10, 10 being the most pain you can imagine. She's at a 4 or 5. And so for a young lady like this, that's significant. So we want to assess what areas is she feeling most of that pain. Of course, on her intake paperwork, she's identifying mostly her neck as being that, which is very, very common in injuries like these. Mostly neck, some low back, and even mid-back injuries can occur because the force of the collision causes that body to rapidly move forward and back so quickly that it causes that damage to those soft tissues. A lot of people complain of muscle pain. Muscles can be damaged as well, but muscles are very resilient. Muscles are loaded with blood vessels and they're able to heal very quickly. So sometimes muscle pain can occur, but usually brain strain muscles will heal within 2 to 4 weeks. And a lot of times those tissues don't get injured in these types of collisions. So our first step is what we'll do is go through range of motion, orthopedic tests. I want to check her areas that she's complaining about pain. We'll then take some x-rays. X-rays are going to clearly define the position of her spine based on what's normal. If there's any abnormalities there, we want to address them in the types of treatments that we provide. All right, so at this point, I will go through the examination process. I'll shut the camera down. We're going to go through our exam. It's a very gentle exam. It doesn't take more than 10 to 15 minutes, but I'm not going to bore you with those details right now. It is very specific for each individual based on what their symptoms are. Join us next time because we're going to go through the x-ray process. I'm going to take you into the x-ray room, position her, show her what kind of x-rays we take, and even show you the x-rays to see what we look for on those films. So please join us next time. That's what we're going to be looking for next. Thank you.